Bismillahirrahmanirrahim. The topic which today we are going to discuss is gingival enlargement. The gingival enlargement refers to an increase in the size of gingiva and it can occur due to several local and systemic factors. The main causes are gingival enlargement is also known as gingival hyperplasia. The main causes are inflammatory causes, which is the most common cause of gingival hyperplasia, such as dental plaque and calculus can lead to inflammation, poor oral hygiene, chronic gingivitis and periodontitis, food impaction and follicle restorations can also lead to gingival hyperplasia. Enlargement occurs due to inflammation, edema, and cellular infiltration. Now, the second is drug induced gingival enlargement or gingival hyperplasia. The commonly associated drugs include anticonvulsants such as phenytoin, calcium channel blockers such as nifedipine and amlodipine, immunosuppressants such as cyclosporin. These drugs stimulate excessive fibroblast activity and collagen production. The hormonal cause can also cause gingival hyperplasia, such as pregnancy, puberty, oral contraceptive use. Hormonal changes exaggerates the inflammatory response to plaque. Nutritional deficiencies such as vitamins C deficiency can result in scurvy, and in scurvy the collagen is weakened, and the bleeding and swollen gingiva occurs. Now, some systemic diseases and conditions can also result in gingival hyperplasia, such as leukemia, especially acute leukemia, diabetes mellitus, sarcoidosis, which is a granulomatous disease. And in this condition, gingiva may appear enlarged, soft, and it can bleed. Now, there are genetic and hereditary causes of gingival hyperplasia, which is known as hereditary gingival fibromatosis. It is characterized by firm, fibrous and non-inflammatory enlargement of gingiva. Neoplastic and tumor-like lesions can also result in gingival hyperplasia. Benign tumors such as fibroma, papilloma, and malignant tumors are rare. Uh, the Despite of all these causes, the gingival hyperplasia can also occur due to an unknown etiology, and it is the idiopathic cause. Now, here you can see it's a summary. The plaque builds up here, okay, and this is a normal gum tissue, and this is a inflamed and swollen gum tissue, and this here you can see a periodontal pocket space. If there is space between tooth and gum, then it's a periodontal pocket. And these are the types of gingival hyperplasia: inflammatory, nutritional, neoplastic, drug induced, systemic, idiopathic, hormonal, genetic, etc. Gingival enlargement due to inflammatory cause. We will discuss gingival enlargement due to inflammatory causes, which is the most common cause of gingival enlargement. Inflammatory gingival enlargement is the most common type of gingival overgrowth. It occurs mainly as a result of chronic plaque-induced inflammation. The plaque, due to poor hygiene, poor oral hygiene, the plaque deposits around the teeth and gum area, and if it is not treated, if the oral hygiene does not improve, then inflammation occurs. The causes of inflammatory gingival hyperplasia are dental plaque, then dental plaque progresses to calculus, then food impaction. Therefore, we should always gargle after eating some food, and faulty restorations and overhanging margins. If the restoration is faulty or the margins are overhanging, you must get it corrected by the dentist. Mouth breathing and poor oral hygiene. Now, what is the pathogenesis of inflammatory gingival hyperplasia? Accumulation of plaque at the gingival margin initiates inflammation. Bacterial toxins stimulate an inflammatory response. Increased vascular permeability leads to edema. And in chronic cases, there is proliferation of fibroblasts and increased collagen production, which results in gingival enlargement that may be soft or firm depending on the stage. Now, there are two types: acute and chronic. Acute, as the name indicates, rapid onset, soft, red, shiny gingiva, painful and tender, and it is common in acute gingivitis or periodontal abscess. Contrary, chronic is slow and progressive, Gingiva appears bluish red. It's plainless, but it bleeds easily upon brushing, upon brushing, and may become firm due to fibrosis. Now, what are the clinical features? Clinically, you can see enlargement usually starts at interdental papilla. Interdental papilla is the area between two teeth, like where the gum is present, a space between two teeth. It may We have always already discussed interdental papilla, attached gingiva. You can check the videos on gingiva. It may extend to marginal gingiva. From interdental and papilla, it can extend to marginal gingiva. Marginal gingiva is around the margins of teeth. The surface may be smooth or lobulated. On probing, it bleeds, and pseudo pocket can form due because when the gingiva is swollen, वो enlarge हो जाता है, तो फिर एक पॉकेट बन जाती है जो कि एक्चुअली पॉकेट होती नहीं है. इट्स अ फॉल्स पॉकेट बिकॉज व्हेन यू प्रोब इट इट्स सॉफ्ट, तो वो उसको अंदर जाने देता है प्रोब को, तो वो बेसिकली पॉकेट होती नहीं है बट इट सीम्स एज अ सूडो पॉकेट. ठीक है. Now, histopathology is dense inflammatory cell infiltrate, plasma cells and lymphocytes, dilated blood vessels, edematous connective tissue, and in chronic cases, you can also see increased collagen fibers. Management of inflammatory cause is removal of local irritants. Like, you first of all improve the oral hygiene. Patient must be given oral hygiene instructions. Scaling and root planning should be done. If there are fault restoration, they should be corrected. In severe fibrotic cases, and if it's a chronic case, then gingivectomy is the option. Now here you can say inflammatory gingival enlargement, which is plaque induced inflamed swollen gum. Here dental plaque, due to dental plaque, poor oral hygiene, and then edema, increased fibroplasia, plaque buildup की वजह से हो रहा है. हिस्टोपैथोलॉजी में आप यहाँ पे देख सकते हैं, ये देखें, ये dense inflammation with cell and dilated blood vessels. This is acute gingival enlargement. Then the chronic, and then it becomes firm fibrotic if chronic. So that is all for the today's lecture. Jazakumullah khairan kaseera. Assalamu alaikum wa rahmatullahi wa barakatuh.